Once there is an understanding of a diagnostic, as we discussed in the disordered processing section, then the diagnostics are designed to drive therapeutic intervention. The purpose of our diagnostics are not to label a person associated with a disorder and to encourage that or society to make that part of their identity. A person is not ADHD or schizophrenia or borderline personality disorder or anxiety, chronic anxiety. A person is a person. The diagnostics are to allow us to lead to the effective therapy and treatment for the right symptomology only. Many forms of therapy have been developed with wide-ranging results. In this case, a military ocean therapy program is what we would consider group therapy. It is supervised group therapy in which post-traumatic stress disorder, PTSD, vets are working together to understand the symptomology and how it affects their life post-military. Now, what we see here in a national survey of drug use and health is the prevalence of various addictive substances and derailing substances over lifespan. So, depending upon age, there's an access provision associated with being able to gain access to certain drugs. And as a result of that, we have different usages depending upon range. But a person that utilizes addictive substances are doing so for the purpose of masking over the pain of another event. And although we might diagnose addictive personality disorder or addiction as a symptomology diagnosable, the underlying problem is the driver behind the prevalence of this coping mechanism. And absent of this coping mechanism, it might migrate to another, an eating disorder or another coping mechanism, if the root cause analysis does not occur. Now, what we notice is that by year, the amount of people that get treatment for mental health problems is fairly stable, possibly associated with the access to formal supervised therapies and health care insurance plans. The adults seeking treatment increase slightly, but the adults receiving treatment is what is shown here, and over the years 2004 to 2008 largely did not change, even though those seeking treatment and those needing treatment have increased fairly substantially since those years. About 1/3 of to 1/2 of the U.S. adolescents age 8 to 15 with mental disorders receive treatment. That's only 1/3 to 1/2. May be driven by the provisioning of health insurance and the access to treatment, but regardless of the sociological phenomena, it is still unlikely that absent of treatment that the condition can necessarily be remediated. Dorothea Dix was a formal social reformer who became an advocate for indigent insane and was instrumental in creating the first American mental asylums. It was an effort to create treatment facilities, but those treatment facilities did not turn out to be high efficacy and were riddled with abuse. Most treatment facilities of this type have been closed down, although there are still certain states, Maine, Texas, and other states who have licensed facilities for troubled teens that are promoted as wilderness therapy or treatment farms, which may or may not involve living indoors or living outdoors in the elements and providing levels of therapy for various diagnosed conditions. What we do know is that homelessness in correctional institutions are heavily driven by mental health problems. And so there is a prison pipeline, a homelessness pipeline that is driven by untreated mental health problems coming out of childhood. So not unlike childhood development should occur relative to play, the remediation of childhood difficulties involves a formal play therapy. That formal play therapy is designed to remediate the lost childhood experiences that occurred due to a disruption. Maybe there was a family scenario in which the development of this child was interrupted by some chaotic events, and then the therapist goes back and recreates the therapeutic environment to uncover or remediate the problems that were left as a result of the interruption of normal Piagetian development sequences. Again, this is play sand therapy, another example of play therapy for children using a three-dimensional world. Freud was notorious for, in part, his idea of psychoanalysis, which we now call CBT, cognitive behavioral therapy. And that is the exploring of the inner self from an emotional and therapeutic perspective. Being able to put the ego aside, difficult, and with the coaching of a therapist, uncover the underlying conditions, either interruption of development or parts of personality which did not get a chance to make manifest, and the psychoanalysis designed to uncover and address. The addressing of what cognitive behavioral therapy uncovers is associated with exposure, meaning new experiences must replace prior experiences. This is a tricky construct because, of course, if a person has a fear of rabbits, the idea of putting them amidst dozens of rabbits is going to create anxiety, create new traumas, and become an unconditioned stimulus for further trauma and anxiety and disruption. So exposure therapy is not as simplistic as giving a person who doesn't like cookies, cookies. It is understanding, is the conditioning associated with being exposed to rabbits necessarily for their ability to thrive? If it is, which again, it may not be and could be unnecessary conditioning, but if it is, a way for that exposure to be framed in positive ways that do not induce fear, anxiety, and negative effect. Again, just an example, unlikely that a person that is afraid of rabbits needs to necessarily be exposed to rabbits, but just to exemplify the condition, this author, this textbook author, is using this example. Now, the idea of combining rabbits and cookies to reduce the fear of rabbits is iffy. The person being rewarded for tolerating the fear of rabbits by being incentivized with a cookie may still inadvertently create a trauma and incentivize further trauma because of the person's motivation to obtain a cookie. So exposure therapy is based upon safety, security, and comfort of the relationship with that therapist or with the social framework, and then that not becoming a betrayal in exposing a person to an experience that is further traumatizing, rather an experience, maybe hiking, maybe some playing basketball, or some other experience that does not involve rabbits, in order to create a conditioned response that is high efficacy, creates skills, and allows the person to not focus on their fears. Again, a person with a fear of spiders, being exposed to spiders makes little sense in any kind of notionality that really the fear of spiders is going to go away. So what we are talking about is internal belief systems. One's emotional responses to a stimuli. So if a person has an internal response of fear to spiders, fear to rabbits, or any other stimulus that they have failed, like, I feel stupid and worthless because I cannot accomplish this academic task. The internal belief that one is stupid and worthless is reinforcing and can lead to depression. Whereas if the internal belief system creates a positive affect, meaning a success, I didn't study for this test, I still did well, the new coping mechanisms that did not traumatize me, maybe a new study technique, maybe a group study methodology, caused me to be successful. I passed the test, I learned the material with no depression. Now I've got a new set of circumstances, which is high efficacy, that reinforced my academic accomplishments and did not create further recidivist anxiety and depression and trauma. Whether therapy is done in an individual or a group is up to a professional assessment. The group is a sociologically supportive group. It can add to the efficacy of the treatment plan. But whereas group therapy might be individuals that one does not know and discussing sensitive matters, which in themselves are traumatizing just to elevate and expose, it would not be advisable to use group therapy. Again, a professional assessment is necessary in order to make that determination. In an individual therapeutic situation, a client works one-to-one with a trained therapist who is licensed by the state to treat developmental and traumatic disorders. In group therapy, usually no more than 10, actually usually more like 5, meet in with a trained therapist to describe supervised a common issue. And because the issue is common amongst the participants, they don't feel grief, shame, remorse in necessarily discussing it. And the supportive nature of the group adds to the efficacy of the therapeutic scenario if done effectively. Dyadic therapy is a group of 2 people that were engaged in the same circumstances. Maybe marriage therapy is the one that comes to mind, but it could be a group of people that were in a car in an auto accident in which one of the members of the car was injured significantly or worse. Substance abuse, and the abuse costs the United States over $600 billion a year because the coping mechanism is addictive and the access to keeping the addiction going is expensive and causes people to become homeless, which is a societal problem, commit crimes, which is a societal problem, and be unproductive, which is a societal problem. The underlying core cause of what it is that leads someone to cope using addictive substances unmet will either, when I say unmet, meaning not getting to the root cause of the problem, just addressing only the addiction, will cause a person to relapse or move on to another type of coping mechanism, which could be as bad or worse. Cultures have an effect in mental health treatment. Certain cultures might be more susceptible to shame, guilt, and remorse, and feel as if they've let society down by an addiction or other mental health problem. And as such, the complexity of the underlying problem becomes more dramatic because we add grief, remorse to the already existing shame and anxiety, and we've compounded the problem. So cultural sensitivity must be considered in all treatment modalities. As well, the influence of Bronfenbrenner social circles. Does the inner circle add to the anxiety, the guilt, the shame, the negative affect, rather than being what a relationship is supposed to be, supportive, encouraging, and validating? Sometimes it's hard because families feel shame and guilt and remorse and stress from one family member's struggles, and as such, externalize their own personal affect onto an already traumatized or stressed person. So cultural reinforcement, familial reinforcement, all social circles need to be thought through, evaluated, and considered in the treatment plan, in addition to the modality of that treatment, whether it's individual, group, or dyadic.